Good afternoon, everybody. Thank you very much to Dave Adamson and to Duncan and Rick. That was really interesting, and I think it's a really good lead-in to the session we've got this afternoon on safe working practices during the COVID-19 pandemic, because we don't need to just think about resilience after the pandemic. We're still in the middle of it. We're still working with it. We have some great speakers with us today, and I would like to introduce them to you. Could I ask that you all turn your cameras on, please? Stella, Frank, Martin. And perhaps, Martin, we'll begin with you.
Hi. Good afternoon, everyone. It's a pleasure to be here. I'm Martin Cottam. I chair ISO Technical Committee 283, which is the committee responsible for OH&S management systems in ISO. And in my day job, I am the Technical Assurance and Quality Director for the Lloyd's Register Group.
Thank you, Martin. Stella, would you like to introduce yourself?
Good afternoon, everybody. I'm Stella Tawana from Botswana. I'm also a member to TC 283, working on 45001. Currently the project lead for ISO 45005. I am a medical practitioner running a private practice in Botswana. Thank you very much.
Thank you, Stella. Frank, would you like to introduce yourself?
Good afternoon, everybody. My name is Frank Lee. I'm the Global Product Certification Technical and Compliance Director here in BSI. That means I look after things such as our kite mark of trust, CE marking, and soon to be UKCA marking here in the UK. I've been with BSI for over 30 years. I set on a number and have participated in a number of standards over the years, including 9001, 14001, 45001, 95009 and 44001 as well, so a whole range of them, and hopefully I can help along this afternoon as well.
Thanks very much, Frank. And just to introduce myself, I'm Sally Swinchwood. I'm a lead standards development manager at BSI, and I'm the committee manager for the Occupational Health and Safety Management Committee in ISO. So let's get started. This session, we're really inviting your questions. It is about helping you and your organisation. So although we have some pre-prepared questions, do feel free to put your questions in the Q&A box and we will do our best to answer as many of them as we can. So today we're going to talk about ISO PAS, Publicly Available Specification 45005, which we are hoping will publish within the next month. Just to give you a little bit of background to this, early in the pandemic, BSI was asked, and indeed the committee, the ISO committee was asked, if we were going to give any guidance to organisations on how to manage these very difficult and unexpected times. People hadn't anticipated them. So BSI gathered together an advisory group, broad spectrum. We included HR experts, facilities experts, health and safety experts, all sorts of experts came together for a cross-functional group to develop a generic set of safe working guidelines that any organisation could use, particularly in those early days. And we had regular public consultation. We published the first iteration in less than a month. We sent it straight out to consultation. We gathered in more feedback. We improved it. The situation, of course, as you know, was evolving. Our knowledge was changing about the virus and what we could and couldn't do safely. And in the end, we had 3 iterations in 3 months, thanks to the extremely dynamic work of our panel. And this was then submitted to our ISO committee to be developed as a global standard. Other countries were already using our UK-based guidelines, but we did recognise the need to make this truly global. So we got consensus with a large number of organisations and a large number of experts from many countries involved. And we're currently in an 8-week approval ballot to go to publication, which hopes we will be able to publish this in 2020, and that ISO stamp will be on it to actually show that we did get the broad consensus across all those countries. ISO 45005 is generic, as I mentioned. It's suitable for any business. It doesn't matter how big or small you are. It doesn't matter where you're based. It doesn't matter what kind of activities you're doing. It's just been developed to reflect good practice from trusted sources across the world. And we do have plans to review it and update it as necessary. The ISO PAS process is infinitely faster than our standard ISO deliverable process. Dave mentioned earlier about delivering something in 2 years and that being a really good outcome, which it is when you're seeking global consensus. I think we took 2 weeks to get global consensus on 45005, and we shall do it again if the situation changes, if knowledge changes, if we feel that our PAS can no longer do the job while you need that help. So let's have a brief look at what's inside it. It's comprehensive and it's practical. The first thing it goes about doing is how you can identify and manage COVID-19 risk in all types of work settings. Martin, do you want to elaborate a little more on that?
Yes, thank you, Sally. I think for many of us, our minds automatically default, don't they, colleagues, to the idea of, well, this might be about home working, or it might be about modifying our own organisation's workplace. But of course, there are a really wide range of scenarios in the world of work, and the document has attempted to address many of those. So we've considered, for example, those workers whose work actually takes place in other people's homes. Then there are workers, of course, who are working in public spaces, perhaps those involved in utilities and services, and have mobile workplaces, those who need to attend or operate on a client's workplace. So there are a variety of situations, each of which brings its own challenge.
Thanks, Martin. And perhaps, Frank, you'd like to say something about how the standard can help you adjust where, how, when you work.
Yes, Sally, thanks. I think the standard provides an awful lot of guidance and a lot of support to organisations and individuals when looking at the different circumstances under which you might have to adapt and work in the current situation, the difficulties that can bring, and actually in balancing those difficulties. Sally mentioned earlier that this is a risk-based standard in many ways, and I think that really helps to adapt and to look at the individual circumstance situations in a dynamic way, and the standard really encourages that, so that we're able to adapt to what we need to do to take account of different circumstances.
Thanks, Frank. And one of the things we've really realised is that consulting with workers on what we do during this time really does lead to the best possible outcomes. Stella, perhaps you could elaborate a little bit more on the importance of talking to people and including them.
Sally, it is very important to include people as well as the workers' representatives. And of course, this is for buy-in, because, you know, if you come up with a standard or guidance and you are not including your employees and their representatives, they are not going to buy in. And if they don't buy in, you know, obviously as an organization, you are going to be the loser at the end of the day. So it is very important to ensure that we are very inclusive in our dealings with our employees. Thank you.
Thanks, Stella. And finally, on this slide is the PAS does recognise the importance of wellbeing and psychological health. I've no doubt that you've all heard that we have a mental health pandemic on our hands, as well as the physical pandemic to deal with. This particular situation has caused tremendous issues, many of which are only just now coming to light. There is a session tomorrow on managing psychological health. I do encourage you to join us for that, where we will be talking about another of our committee standards, ISO 45003. But this PAS does include some tips and practical guidance for how you can see the issues and what you can do about them. So Martin's already mentioned that we do cover managing different work situations. Do you want to say a little bit about managing the outbreaks, Martin?
Yes, thank you, Sally. I think there are challenges for organisations in a number of areas here, not least of which is compliance with changing guidance. And so because of this is an international document, of course, the stance we have taken is that it is for organisations to follow and identify changes in guidance as they occur in their own local context and respond to that. But of course, there are situations here to consider. The worker may be remote and working from home, or may have had limited contact with colleagues, and there's the question of assessing whether there is any possible routes to transmission amongst workers. If not, then the questions are about the safe return of that individual to the workplace in due course. But obviously in situations where the outbreak occurs in the organisation's own physical workplace, then there are matters to deal with in terms of dealing with an individual who becomes sick on the premises, and how to deal with that situation to isolate that individual until they can safely move to a medical facility or to home, and then dealing with the possibilities of transmission that may have occurred or risks of transmission within the workplace.
Thanks, Martin. And perhaps we can bring Stella in there, because that really relates very strongly to the second bullet point on the slide about dealing with contact tracing, testing and quarantine, which in many countries has become very political. It should be a fairly straightforward thing in terms of stopping the spread of a disease, but politics has made it less so. Stella, would you like to say a bit more about this?
Thank you, Sally. I don't know whether I'm audible enough. I've been told I'm not very audible. Okay. Really, when it comes to contact tracing, testing, and quarantine, it's something that also brings us to what we have in different countries. We need to really look into the national guidance for each countries and the legal requirements, because it brings on board issues of confidentiality. For example, here in Botswana, when it comes to contact tracing, everybody, in every workplace, the workplace has or is required to put in place contact tracing measures. Every time you go to a workplace, to a business, to even to a church, even to a funeral, you are required to register your name so that contact tracing can be done. But as Martin said earlier, issues of contact tracing, it will assist us in ensuring that we stop, or maybe not necessarily to stop, but we control the spread of the infection. Then when it comes again to testing, there's a lot of issues around testing. We know that with COVID-19, not everybody will come up with symptoms and signs. Who do you test? When do you test? As a workplace, can you force somebody to take a test or not? Then issues of quarantine, you quarantine somebody when it comes to issues of salaries, etc. Are they going to get a salary when they are quarantined? Are they using their own days of leave or not? Or they're going to be given some sick leave or not? So these are some of the issues that we really need to look into as we come up with specific guidance for our workplaces.
That's right, Stella, thank you. And the regional differences obviously is a big challenge when you're writing a global standard. So we have included some generic tips and practical advice on how to manage this in your organisation. But you will find in ISO 45001 that we repeatedly say you must look to local requirements and local guidance. You must follow what is in place in your own country. But regardless of what is in place, there are some practical steps you should consider taking to protect the people in your own organisation. Now, Frank, I'd like to come to you to talk about responding effectively to sudden changes in restrictions in rules. Obviously, in the UK in March, we had a nationwide lockdown announced very quickly. People didn't have a great deal of notice to prepare for it. And then in the subsequent months, suddenly restrictions were lifted and reimposed, and lifted and reimposed. So the PAS deals with this to a certain extent. Do you want to say a little bit about that? Any tips you can give people?
Yeah, I think this really is looking at basic planning for what could and what might take place. I talked earlier, I think Sally, you mentioned earlier on about risk, but also it looks about the context of the organisation. And I think when we look at the circumstances in which we're going to have to work and changes to those, we're going to have a very dynamic response. And to me, that requires us to be pre-planning, to have a number of scenarios and eventualities that we'll need to be able to implement at very, very short notice, depending on what happens. Certainly in the UK, some of the things we've realised and seen is that, of course, these can change even regionally within a country. And as a result of that, you can find that organisations in one area might have to be operating differently than their sister sites or plants or offices in different ones. So I think it really is important that people are well trained, that there's lots of scenario planning put into place, systems ready to go, and a process for dynamically evaluating the circumstances and adjusting the risks. And these will, of course, also depend very, very much on the nature of the business that you're in. Do you have a lot of people coming from, a lot of visitors to your site from other organisations? Are you a hotel where you have people coming from all over the world? Or are you a production facility that has pretty much the same people coming every day? So your circumstances will all be different, but these can change. And as the rules change, as the restrictions change in your area, then you need to be able to very quickly adapt to take account of them. So I think organisations that build and put into place this dynamic evaluation of circumstance, of risk, and then have a number of different scenarios that they will implement at relatively short notice will be the ones that will be best equipped to cope in the future as we see things change. Sally, that's okay?
Thank you very much, Frank. And the nature of the standard does essentially take you step by step through a risk assessment process. So hopefully the standard is providing sufficient signposts and guidelines as to think about these things, take into account whether this works, whether this is applicable to you. As Frank says, it's all about your own context. Everybody's situation is slightly different, depending on the type of organisation you are, but also where you are and how bad the situation with the virus is at any given moment. So the PAS is intended to be step by step, but also a cyclical thing. Keep looking at how it's changing, and then hopefully nobody will be caught out quite as badly as they initially were in this situation. If we are to live with this pandemic for a long time, and it certainly, even with the advent of potential vaccines, doesn't look like it's going to suddenly improve overnight across the world, we do need to be better prepared to save lives, but also to save our jobs, save our economies. So there's a big picture here, as everybody's aware. Martin, would you like to say something about the importance of communication in these times?
Yes, certainly, Sally. And I think it's a good time for us to be talking about that, isn't it? You know, just as on the one hand, we hear the news and perhaps our spirits are raised that perhaps there is an end in sight to this situation. And then the counterbalance, the reality being, well, that's still some way off in the future. And all of us, I guess, as people and as members of organisations are somewhat fatigued with this most challenging year. So I think the real issue for many of us is about sustaining our attention to this and adapting for a continuing period. So communications is key. I mean, it's always key in anything we talk about to do with management systems, of course, and in particular in relation to health and safety. But that issue of sustaining the message, reminding ourselves what is needed, reminding people why it's needed, and then monitoring our conformance, looking at the effectiveness of the measures that we're taking, gathering feedback on what's working and what isn't working, in particular getting feedback from workers themselves across the organisation, so that there's a real dialogue about what needs to be reinforced, what may need to change, making sure that we investigate incidents that occur and really understand root causes if we haven't achieved what we set out to achieve, and just keep monitoring and adjusting that plan, do, check, act cycle. And we just have to keep that going for some considerable time, it would appear.
Thank you, Martin. We're already getting questions through. So as I say, we have prepared some questions, but I'll start with the 2 or 3 that have come through in the chat. And the first one is very easy to answer, but I'm going to give it to Martin. What's the difference between ISO 45001 and ISO 45005? And is ISO 45005 replacing 45001?
Okay, well, thank you for the question. And it's a good question, and we probably should have laid out our stall a little more clearly for everybody right at the start. So ISO 45001 is the main overarching requirement specification for occupational health and safety management systems. It was published in 2018, and that's the time at which this ISO technical committee was formed. It took about 5 years to write that standard. It's used for in a number of ways, but many of you will be familiar with it being used as the basis for management system certification. Since then, our committee has worked on a number of additional documents, of which the numbers provide the clue. ISO 45005 is one of those. What we've developed since then are all guidance documents which support the implementation of the principles of ISO 45001, but focusing on specific circumstances or situations. And so this document is guidance in relation to OHS management in the context of the pandemic. It's helpful you can read it across to the overarching framework, but equally it's a document capable of being used in isolation on its own terms, so it can be used either way. And there are other documents in our family. Sally, I think, referred to one earlier. ISO 45003 relates to psychological health and well-being in the workplace. And we have other work in progress, which will produce other documents, including one on performance measurement for occupational health and safety management. So ISO 45001 will not be superseded for some time, which will be a relief to those of you who have followed the certification path. Although it's probably fair to mention that obviously, given the time it takes to effect a revision of a major international standard like this, we are already beginning to give first thoughts to the timing and nature of a revision. But I don't want to raise any concerns for anybody on that front. It's unlikely that you will see anything rolling off the presses until around about 2025, I would say. So the standard's going to be static for some while to come. So I hope that provides some guidance as to how this family of documents fit together.
Thanks, Martin. So just to repeat, no, ISO 45001 is going nowhere. This does not replace it. It is something you can use whether you use 45001 or not, or you can use it with 45001. Martin just mentioned that we are already beginning to look at revision of 45001. The world has seen some extraordinary changes and we need to keep an eye on the future and make sure our standards are relevant. Charles Pascal has written, you made a statement earlier that the pandemic was not foreseen, but President Obama made a speech in 2014 where he predicted exactly this outbreak and pandemic. So why were we so ill prepared? And I think that's an excellent question. We've had discussions in our own ISO committee that actually 45001, if you did it to absolutely the nth degree, you should have been prepared. It's all in there. But the reality on the ground is we weren't expecting this. Frank, do you want to say something about this?
Oh, thanks for that one, Sally. I was hoping
Well, I saw you smiling.
Why were we not prepared? I think that the basic reason why is that most of us of the generation that will be on this call have never lived through such a thing in the past. We have enormous confidence in medical science. We have great confidence in the pharmaceutical companies, in our hygiene systems, in our hospitals and healthcare systems. And I think we simply did not want to accept the reality of what might happen and the impact that it might have on our economies and on the way we live. We've never lived this way before. It's a complete and total shock to us. And I think we simply chose to ignore the possibility that it could ever occur. And I am equally guilty as anybody else. That's the best answer I can give, Sally.
I think it's a very good answer. I'd like to bring Stella in, though. As somebody who works in a region where there have been epidemics of deadly diseases more recently, perhaps you have a slightly different take on this?
Okay, thank you, Sally. Actually, I've never even heard or read the speech that the person who asked the question refers to. It's usually very, some we can predict, but most of the time it's very difficult to predict this pandemics when they come through. And as you said, if we're using our 45001, if we're using the usual, hand washing, etc., that we normally use for our seasonal flus, etc., we could have been, a little bit more prepared, but it's something that just came. Yes, we are not prepared, but the important thing right now is that we are doing something. We are trying to do something to try as much as possible to reduce the rate of infections, and where the infections are there to try as much as possible to save lives. So it's it is one of those things, especially because it is, again, something that is very new and that is sort of changing, or might change as time goes on. So it is even very difficult to say we have 1, 2, 3, 4, 5 in place, because we don't know what's going to happen tomorrow, whether this virus is going to be very resistant or not, we don't know. So we sort of come up with interventions every day as the time goes by. So that's really my answer to that.
Well, don't go just yet, Stella, because I think we are in the committee also looking at developing a document about preventing and managing infectious diseases related to work and in the workplace. And I think it's interesting because, yes, people have talked about pandemic planning before. There have been pandemic response teams that have come and gone, and, we can say we should have been better prepared. But in our first examination of our COVID-19 standard, we are already realizing that what we have in that standard may not apply next time. Do you want to say something about just the variety of measures and issues and challenges that can come from infectious diseases of the sort that can cause a pandemic? They're not always respiratory, are they?
No, they are not always respiratory. We do get, you can get your gastroenteritis, something that would affect the digestive systems, your skin, etc. So pandemics can come, viruses can come through, and they can affect different parts of the body. And it's, the only thing that we can come up with is something that is very, very generic. And, viruses, when they come, as I said, they can affect different parts of the body. They can enter the body through different parts of the body, whether it's the skin, whether it's the eyes, the mouth, or whatever way. Then when you look in the situation for us in the developing world, you might have just usually give an example of TB, that you could have something like TB where you just have just that one person with TB. And if you don't do anything about it, you can end up with something very catastrophic. So it is, all I'm saying is that we can only come with generics like we are doing with the standard that we are planning to come up with for infectious diseases, but we can't prepare for a specific disease or for a specific infection.
Thank you. Thank you, Stella. I have had a question from Peter Hebard about face masks, which I'm sure Martin is really looking forward to. But I'm going to ask us to hold on to that for a minute, because we have some other questions previously asked on face masks. So we'll make sure that we cover Peter's question when we come to that. So Peter, we're not ignoring you, but I'd just like to come back to it in a few minutes. Okay, so one of the very pertinent questions at the moment in the UK, given that we're in the middle of a lockdown, a national lockdown, but it has got a set end date by law at the moment, is this, should we, this is not the one on the screen, is it? It should be the one on the screen, that one. If working from home is 100% effective and it works for the individual, is it sensible to return to the office environment when the lockdown ends in your situation, in your country? Stella, would you like to have a go at that one?
Okay, thank you, Kylie. I think this one really depends on the organization, if whether the organization has put in place measures to ensure that there is reduction of possible risk of infection. So my answer to that would be just go back to work only if you are sure that you are going to be safe in the workplace. We know that employers have a duty of care, in some places a legal duty of care, to ensure that the workplace is as safe as possible. And we should also not only be looking at ourselves as individuals, we should also be looking at the organization, at the business. We know that a lot of businesses they are not doing very well. They have lost money because of these lockdowns. And therefore, as we work from home, it might also be a little bit expensive on the business, because the business is now forced to ensure that they supply us with internet, with chairs, with desks in the workplace, even just the support that one would normally need in the workplace. If you have a technician that is there and the business at the workplace and they are supporting or they are assisting 10 employees, it's much better, or it's much cheaper for the organization, unlike getting one person going to every workplace. And for you as an individual, you need peer support. You need that people-to-people interaction. And you also need some management of time, because when we work at home at times, we're also not looking at the time, that homework balance. So when you go back to the workplace, it also gives you that opportunity to look after yourself as an individual from the mental health perspective. Therefore, I would say, go back to work if the organization has put in place measures to reduce risk. If risk assessments have been made, if they've been carried out, you can also request for a report just to make sure that controls are in place. And also we look at the general, community. If the infection rates in the community are going down, and the government has also, or whatever national regulations that could be around you, local regulations are in place, then I would say it is safe as long as those measures are in place. Thank you.
Thanks, Stella. I'd like to turn to Martin now. Can you say something about how to go about maintaining physical distance during work activities? We know that limiting contact with other people is one of the best ways to manage spread of infection with COVID-19. What advice would you give?
Well, again, Sally, as we've said before, many of these things are very much specific to the context of the organisation. So there are a range of options, but each organisation will need to, I think, assess for itself which is the right solution or combination of measures that it can take. But I guess one of the starting points is always to think about the scope to limit the population of people in a given location or on site or in a facility or an office by asking the question, which many companies have asked right from the start, who can successfully work from home? But of course, beyond that, you've also got the option of using time as a separator and asking, well, can we limit the population that's present at any one time? And that's where, of course, there can be real advantage in staggered arrival times and departure times. And that can help avoid overcrowded entry and exit spaces, for example, in a premises. Clearly, physical distancing is the ideal, but there can be occasions where that's tricky, and the insertion of physical barriers and screens can be helpful. I think organisations can think about their premises and think, well, can they use the space differently to create space where there perhaps wouldn't be, to use spaces which are perhaps not normally used for work activities in order to disperse people slightly more widely around the premises. And of course, also limiting the number of people that an individual interacts with through team organisation. And of course, that reads over also into things like limiting the number of people who share common pieces of equipment, for example, or tools. And of course, you have to think not just about the person when they've successfully arrived at their workspace, but also all the other parts of the facility or the premises that may be relevant. So, one-way entry and exit systems and routes around the premises are important, the exit entry routes, and of course also to think about exit entry routes in emergency situations. We need to remember that we're managing one risk and don't want to start creating others. So we still have to be able to manage emergency evacuation and the like. And then, of course, there's also the need to think about communal spaces, whether that's kitchen areas, toilets, or whatever it may be, where a restriction of the number of occupants in those spaces and perhaps is probably the key way to achieve that.
Thank you. And I'm realising we are galloping through time. So I'm going to ask you all to give nice short answers, please, from this point onwards, so we can try and get some more questions dealt with. We've got some in the chat that I'd like to go to before we go back to the slides. Very interesting one off Peter about in other parts of the world, in the Far East, for example, the Far East has had an initial poor situation with the virus, lots of cases, deaths. They got it under control relatively quickly in many countries and have managed to sustain that success. In Africa, it has never hit as hard as it has in Europe or North America, for example, or indeed South America. And there's a question here that a lot of the guidance that's been given out has been very simplistic and not very joined up, which has caused issues and means that a lot of organisations, even following the rules, aren't really managing to manage their risk properly. So the question is, does the standard do anything to explain the mechanism of infection to help people do this? I'd like Stella to take that one, please, being our medical practitioner.
Okay, thank you, Sally. Yes, the standard does touch on the mode of infection as well as the symptoms and signs, etc. but not the mechanism, because obviously mechanism would be too clinical to be in this kind of a generic standard. But as you said, it's really generic. It is for us to then go to our workplaces and businesses and come up with something that suits our workplace and something that is sort of linked to whatever national guidance that we could be having. And when he says, like, for example, here, he said something about Africa, something about the Far East, that what we did, we also learned from what happened when this pandemic started in European countries, in Spain, etc. So is that, governments then decided to put in place, from a legal requirement perspective, to say, like, for my country, you can't go anywhere without a mask. It is something that is there that everybody has to comply to. And if you don't comply, there will be a penalty to that. So I think that, sometimes you get to spaces where you are also looking at human rights versus, are we going to be able to prevent this infection or not? So the clinical mechanism is not there, but we do speak to a lot of communications, as Martin spoke to earlier, that there's need to also involve, workers, to involve their representatives in whatever we come up with. Thank you.
Thank you, Stella. And just to go a little bit further on that, the standard does quite specifically cover high risk areas like entrances and exits, like areas where lots of people may be touching things, small spaces, using good ventilation, that kind of thing. So there is very practical guidance in there, which is directly related to how the virus spreads in very practical terms, which you can then apply to your own situation. I have a question here, I think, for Frank. Risk assessments only seem to take place at operational levels. Should leaders be taking responsibility for elaborating corporate risk?
Okay, well, thanks for that one, Sally. And before maybe I answer that one, if you don't mind, I'd just like to go on one point from the previous two questions, really, because I think it's absolutely vital. And I think there's a fundamental thing in prevention of the virus, and whether that be related to social distancing or preventing the virus, which is education and communication of the risks and why certain things are required. And I'd like to give one very practical example, which I heard of yesterday, which was an organisation that has put in place social distancing and the use of masks when people are reasonably close together in work areas. And this is followed religiously by people in that organisation. And one employee started to feel unwell a few days ago. They left the building with colleagues. They all wore their masks as they left the building. They all social distanced during the day. And as they left the building, they took their masks off. They got into a car. And the person who was contagious then infected two other people in that car. Other colleagues they'd been with during the day, who they remained separate from and wore masks, were not infected by that person, but the people that they travelled with subsequently were. And so it's not just about what we do when we're in work, but it's about communication and education so that people do this every single day and it becomes habitual, which I think goes to your point as well, Stella, about the wearing of masks. So I think there's a big piece for us to do on communication and education still. Moving on to the question you asked me, Sally, which is about risk assessment and senior leaders, I absolutely think it should, yes. I mean, we need to start looking very, very carefully at corporate risk. We need to look at overarching risks to the organisation. And in fact, risk at a high level in an organisation should be the starting point for the development of much more tactical risk assessment measures further down and at a more local level. So absolutely, yes, I think.
Thank you very much.
Yes is a short answer, isn't it?
Yes is a great answer. The question did in fact also reference government. Should government be doing the risk assessment for corporations?
I don't think government should be doing the risk assessment for corporations. I think government needs to do the risk assessment for the country as a whole, which to some extent what it is doing with the imposition of lockdowns and other measures. I think what government can do is it can set a legislative framework that organisations have to work within, and it can provide guidance and support on competence, on measures, and other such things. But I think we shouldn't abdicate responsibility for our own actions to government either. We're all responsible for doing something, whether it be leaders in the country, leaders within our organisations, or us as individuals. We all should take responsibility for what we do.
Thank you, Frank. And we're back to everyone wear a mask, aren't we? Let's not blame everybody else. Let's do what we can. Let's wash our hands and wear a mask. Okay, Martin, I have a question here from Anne Hasty. She's a trustee of a charity that is a frontline advice agency. There is an expectation from governments, national and local, that we should begin to open the door and allow people to have face-to-face advice. Although paid staff are working well remotely and the majority are preferring it, and they are very concerned about the unknown risks and the known risks of restarting face-to-face advice, even though lots of precautions have been put in place. What advice can you give to best meet everyone's needs? How do you deal with these different levels of comfort as much as anything else?
Well, I think in some ways the way you phrased that question towards the end, Sally, sort of gives the clue that individuals' situations vary. Individuals, employees of the charity certainly will have a range of perceptions, and I think consultation is a key part of that. And of course, what isn't quite clear in the question, but is really important, is actually it sounds as if the giving remote advice is working well from a staff perspective. I guess the question is it working well from a user perspective, or are there any barriers to entry for groups for whom that doesn't work? And is that why the organisation's feeling under some pressure to establish some form of face-to-face dialogue? So certainly, I think there's a case for thinking through what is the set of circumstances under which a face-to-face engagement is going to be better for all parties than a remote one, and starting down a very cautious path, I would suggest, of applying a change of approach only where you can really determine that there is a material benefit in the service that can be provided. And clearly, as the question has made clear, there are a set of precautions and conditions to be applied. And I think it's a question of perhaps testing how individual employees feel about that if it's implemented on a small scale. And I think, you know, where there's the opportunity to test something small scale and get feedback, that certainly is a more sensible way to go than perhaps making an immediate decision to sort of return to an all face-to-face arrangement.
Thanks, Martin. We are getting questions through thick and fast. We have 5 minutes left, so we're not going to cover them all, is the bottom line. And we're going to finish with masks, because masks always come up every time we talk about the standards, so be prepared. But before we go there, I think very, very briefly, Stella, perhaps, what legacy do you think this pandemic is going to leave in terms of working practices when we're back to normal, if there is going to be such a thing?
Okay. The legacy really is from exactly what we are doing right now. We could be at some conference somewhere in one room. We have seen that we are able to work from home. We don't necessarily need to be going back to work. So maybe flexi hours where we are not using flexi hours, meetings, online meetings, and that will obviously save our businesses a lot of money. Travels, maybe there could not be no need for travels. Then when it comes to occupational health and safety, I think for us really with our 45001, this is something that is going to take the standard out there to people. You know, the need to say now we need to really have SHE officers in the workplace where we wouldn't normally think of taking our budget to it. Then of course research, people are speaking of vaccines and all sorts of things. So I think this is not necessarily from a workplace perspective, but generally I think governments, politicians will also see the need to put money into research, whether it's at university level or at business level. Thanks.
Thanks, Stella. Anybody want to add anything to that very briefly? Are we happy to move on to masks? So we've had many questions when we've done webinars on this standard and the guidance about whether masks are safe to wear all day. How do we make people wear masks when the guidance has been very conflicting, the knowledge has been conflicting, where a lot of people half-heartedly wear a mask but don't really wear it in such a way that it would do anything, or they are wearing perhaps a scarf over their face but it's very thin and very flimsy. And the first question that we had through is that it's been shown over time, knowledge has been gained, evidence has been gained as to good quality mask does make a difference. And even a basic surgical mask is more effective than a cloth face covering, which is sort of homemade perhaps. And we are all over the world now saying wear a mask, but currently people aren't working to any standards. Should they be? Should we be having standards for the type of masks we are wearing? There has been a SEN workshop agreement, which was another fabulous example of agile standards development at speed early in the pandemic. A lot of European countries came together to develop a standard on face coverings and face masks. But do we need to go further? Martin, please.
You asked for short answers, Sally, and so I think a yes would probably suffice in this case. I think it would go a long way to addressing the confusion and variability that you described, and I think it would be a welcome step from many people's perspective.
Thanks, Martin. Frank, do you want to add anything? I know there's a lot of assurance activities going on in various aspects.
Well, yes, and I think I tend to agree with Martin, actually. I think that it would be good to see more standards in this area, a lot more work in this area. I think one of the questions that came up on the chat earlier, if I remember correctly, was about face masks that actually might be able to prevent the infection or do something about potential infections. I haven't heard or seen anything on that, but it sounds extremely exciting. I think had you said to me a year ago that this would be something that we should be looking at, I'd have said, my goodness, no one would possibly want that. So I think it's a testimony to how much the world has changed in the last year that I'm now saying I think it would be a brilliant idea. But absolutely, yes. I mean, obviously, we've been looking at face coverings. We've been looking at trying to provide assurance on face coverings. It's not always easy, but there's no doubt that face coverings, absolutely, and masks in particular, do help. But it's not just what they stop coming through. There also has to be comfort, as you say, in the way people wear them. There's the breathability. And certainly when we in BSI were looking at a lot of face masks that were coming through surgically in the early stages of pandemic, we had an awful lot of failures based on simply the inability of these things to even meet the basic standards. So an awful lot of work still to do, I would say. But absolutely, yes, we should be doing more work. We should be looking at standards, more standards in this area, I think.
Thanks, Martin. And Stella, from a medical point of view, do you advocate wearing a mask? Do you advocate wearing a certain type of mask? And is it safe to wear one all day if you're working?
Okay, Sally, yes, I advocate wearing a mask. I think Frank earlier gave us a typical example when he said, the workers, somebody had a mask on the whole day, got into a car, then suddenly they transmitted infection to somebody else. So yes, we should be wearing masks. Yes, we know that workplaces are different. There will be very specific vulnerable groups, such as healthcare workers. Obviously, their masks will be different from everybody else. But coming up with a standard will help us to come up with very comfortable masks that can be used by everybody. And yes, wearing a mask the whole day. I know sometimes I get to be asked about manual workers, whether they should be wearing a mask when they are doing whatever they are doing, you know. To say yes, they need to wear a mask. And obviously wearing a mask, you need to couple it up with, you know, social distancing, etc. If you are alone there, then they might not be necessarily for you to be wearing a mask throughout. We still don't have a lot of studies out there. This is a new virus that has come through, but we have seen that having a mask on does assist. Thanks.
Thanks very much, Stella, and thank you also to Frank Lee and Martin Cotton. We are out of time. It has gone incredibly quickly. We haven't even begun to touch on all the questions that we have got. But thank you all for listening. The BSI Safe Working Guidelines are still available for free from the BSI site. The ISO developed document will be available from December, and hopefully that will also be free. So please do download them, do use them, and do get in touch with us. I think the slides may be shared with you. We can certainly find a way to answer your questions offline if that's helpful. Thanks ever so much, everybody.